Hey everybody, it's Caitlin. Today is Tuesday, April 7th, and welcome back to CoronaChat. So yesterday we talked a little bit about home care for somebody who is sick with coronavirus, particularly with mild COVID-19. And as the person who's taking care of that person who's sick with mild COVID-19 symptoms, how do you keep yourself safe? The short answer is hygiene, 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 plus social distancing, right? So oftentimes our natural instinct when somebody gets sick is to sit with them, stay by their bedside, comfort them, rub their back. And with coronavirus, we have to shift the way that we do these things, right? So sitting by the bedside probably isn't a good idea right now. If you're able to have the sick person stay in a separate room with the door closed, you as the caregiver want to stay on the other side of that door as much as possible. So use FaceTime or Duo or other video chat services to check in on your loved one, keep them company, but you don't want to go in and actually sit physically in the room with them. If you share a small space, like a studio apartment, right, we talked about trying to create different zones so that the sick person's in one zone and you're in the other zone, right? And so you want to try to keep at least 6 feet of distance between where you're sleeping and spending most of your time and where they're sleeping and spending most of their time. If you can put more than 6 feet of distance, the more distance, the better, right? When you have to get closer, for example, to give them food or medicine, put on a mask and gloves if you have them. If you don't have a mask, a bandana or a scarf or even an old t-shirt will work, right? And if you don't have gloves, that's okay. Washing your hands well with soap and hot water also will do the trick. So for example, if you're bringing food to someone who's sick, you might try setting their plate on the floor outside of the room and then going to a different part of your home and texting them to let them know that their food is ready. And so they can come out, get the dish, take it back into the room with them, eat, and when they're done eating, come back out, put the dish back on the floor, close the door, go back to bed, and then text you to let you know that they're ready for their dishes to be picked up. Then when you go retrieve the dishes, you want to do that with gloves and mask on, right? Go retrieve the dishes, go straight to the sink or to the dishwasher and wash those dishes with soap and hot water. That's with your gloves and masks still on. I know it's a little weird, but keep that stuff on. Once those dishes are washed and clean and you put them up to dry, then you're going to take your gloves off, right? And if they are disposable gloves, you're going to throw them straight away. If they're reusable gloves, or if you need to reuse them because you don't have enough, you want to put them into a solution of 10% bleach. So it's 1 part bleach, 9 parts water. With those gloves off, but your mask still on, you're going to wash your hands with soap and hot water. That full 20 seconds, front, back, all the parts. Do that full thing and dry your hands. Then and only then can you take off your mask. If it's a disposable mask, wrap it up, throw it away. If it's a cloth mask that you're going to reuse, take it off, fold it so that the part that was facing outside, facing the sick person, is kept all wrapped up in the inside. Put it straight into the laundry. Once you're done with that, you want to go wash your hands again. Again, hot water, soap, the whole 20 seconds, sing your favorite song routine. And so this is the other thing. You're going to want to make up a small spray bottle with your 10% bleach solution, right? Again, that's 1 part bleach, 9 parts water that you can use to wipe down surfaces. You can also use Clorox wipes or some other similar disinfectant, but the 10% bleach solution works perfectly well, and it's cheap, easy to make. You just want to make sure that you're making up a fresh 10% bleach solution every day because the bleach can degrade over time. So don't make a huge, big, multi-gallon jug of it if you don't need that. Just make enough that you need for the day because you're going to have to make more later. So after you've kind of washed your hands, all that kind of stuff, you're going to take that little bleach bottle, spray down any of the surfaces that you touched. So, the outside of the washing machine or the dishwasher, the faucets for the sink, anything that you may have touched. And you want to use that bleach solution to also clean down any hard surfaces regularly. So countertops, sink faucets, the door to the fridge, all of that kind of stuff, doorknobs in general, anything that's a high touch surface, you want to make sure that you're kind of bleaching and wiping down. When you do laundry, it's a good idea to put your gloves and mask back on if you have them. Try not to shake dirty clothes and sheets around more than absolutely necessary, particularly anything that was in contact with the sick person. This is because we don't want to kind of generate virus particles and have them spraying around the room, right? As far as we can tell, there's nothing specific that you need to do with the laundry, nothing special. But if that changes, I'll be sure to let you know. Hope this has been helpful. Drop your thoughts and comments below, and I'll see you tomorrow. Stay safe out there.